on Saturday morning, we got a phone call off him telling us the fact that he was being moved to another ward. He didn't know anything. It was just literally his last phone call to us.
What to say in a final phone call? Raj Aggarwal's family had no idea it would be the last time they ever spoke to him.
And he said the breakfast was horrible and he wanted some Coke, and we all told him that we loved him. And he actually told us that he loved us back. I didn't think that he's not coming back. He was full of love.
A successful businessman, Mr. Aggarwal had started out working in the family's shop. He was well known for his charity work, which included delivering food to NHS workers during the pandemic. He was also well known for his irrepressible sense of humour.
He was on crutches and he was still dancing. That was Raj all over, that was his personality.
But he wasn't going to let the crutches stop him?
No, nothing stopped him. Nothing. You couldn't stop him.
Mr. Aggarwal was just 51 when he died from COVID. Today, new research confirms what many in this community say they've long known, that those from an Asian background are 1.5 times more likely to get the disease. And if you're black, you're twice as likely to become infected than if you're white. Early on in this pandemic, studies began to show the disproportionate impact that COVID was having on ethnic minorities. But last month there was criticism when the government's race disparity unit said ethnicity should no longer be used to judge whether people were at risk, and that structural racism played no part. Researchers hope that this will now be revisited in light of today's study, which is the biggest of its kind. Data was pulled from more than 18 million people who had taken part in studies in the UK and the USA by researchers from the universities of Leicester and Nottingham. As well as the increased risk of infection, they also found that those from an Asian background are more likely to end up in intensive care. Do you think there's a genetic link?
I think ethnicity is a construct. I think it's very unlikely that there is a genetic reason underlying this. It's much more likely to be socio-demographics, occupational risk, and behavioural risk.
The findings raise ethical questions, such as who should be prioritised for the vaccine.
Individuals from Asian and black backgrounds are at increased risk, certainly from our data, but there are other risk groups. There are individuals who are elderly, who have underlying conditions, if you're in a nursing home, for example. And so it's weighing up which is the highest risk population and then targeting those individuals.
Raj Aggarwal's family wants the government to do more to raise awareness and to protect those from a minority ethnic background, especially key workers, including retailers.
There is a number of things that they can do. We're now 6-7 months into COVID. Definitely something does need to be done.
The couple lived happily with their children and Mr. Aggarwal's parents, a multi-generational household, a factor also known to increase risk. And they had barely had time to process his death when they were faced with further heartache.
We lost Raj late morning and we had to come home, and then unfortunately the next day we lost my father-in-law. I think it was down to the shock of hearing about Raj.
We done two funerals and we never think that it's going to be happening in our life. We were so happy family.
Today's report is just the latest to confirm the increased risk to those from a black or Asian background. But this is of little comfort to those who are grieving, unless they say it leads to action to protect the most vulnerable. Darshna Soni, Channel 4 News, Leicester.
Well, joining me now is the former Deputy President of the Royal College of Nurses, Yvonne Coghill, who also directed the Workforce Race Equality Standard at NHS England. This correlation between ethnicity and raised risk has been known for months now in different forms. What has changed, for example, in the NHS to mitigate that raised risk?
I have to say that, first and foremost, I feel incredibly sorry for the Aggarwal family and what they are going through. It is absolutely horrendous, and my heart goes out to that family. In terms of the NHS, you're absolutely right. We knew probably in May that disproportionately people from Black, Asian and minority backgrounds were more disproportionately being affected by this awful pandemic than their white counterparts. And the Office of National Statistics did work back in May, and we actually knew that that was one of the issues. And indeed, the NHS, the Chief Executive of the NHS, asked for a piece of work to be done by Public Health England, and we had a report out in the early summer actually stating that that was the case, that we knew that disproportionately our colleagues in the NHS were being affected because we have, as we know, 20% of our workforce from a black and ethnic. So we have done quite a lot, actually. The NHS has risk assessed the black and ethnic minority staff in the organisation. So all organisations, provider organisations, have risk assessed staff. We've made sure that people have adequate PPE, that they are kept safe, and that people know that we are going to be caring for them. In addition to that, the NHS has set up a health and race observatory to look into deeply what is going on for black and ethnic minority staff, because you have a lot of people talking about houses of multiple occupancy, you have people talking about comorbidities, you have people talking about vitamin C, and people aren't talking about all the other things that black and ethnic minority people in this country on the whole have a much worse experience of living in the country than people from white backgrounds. And the fact is that that impacts on their physical as well as their mental health.
And do you think this should be a factor when we get to the vaccination programme?
I think that all people who are at risk should be equally assessed, that people should look to find out exactly who those people are, what the issues are, and offer them the protection that they need and deserve. I think that the NHS is working its socks off.
Yeah, but does that mean that the black and Asian people should get the vaccination before white people who are in other ways equal?
No, I think that everybody who is at risk deserves to be given protection, to make sure that everybody, regardless of their background, gets equal services and equal care within our NHS. And that is what we strive to do. That's what we have been striving to do from the very, very beginning of this pandemic. I know that my colleagues who are in the NHS are working tirelessly to make sure that that happens.
And what do you think of this argument about whether race should be part of it at all? That actually it's not ethnicity, it's social factors, it's housing, it's poverty, it's the job you do, and those are the things that we should be concentrating on. I mean, some people think that's a way of sort of denying structural racism.
I think it's really interesting that we actually heard that a couple of weeks ago. Personally, I believe that there's lots of factors that impact on black and ethnic minority people in this country. And as I said earlier, this is a systemic issue for lots of black and ethnic minority people who across our globe actually have a worse experience of life than their white counterparts. We know that. We have so much evidence that show that. So it can't just be that it's where they live and their jobs and the fact that they have comorbidities. The question is, why do they have live in houses of multiple occupancy in poor areas? Why is it that they have the types of jobs that they have? Why is it that they actually have the diseases that they actually get? So from my perspective, I think it means that we should be looking at...
Sorry to cut you off, but we're out of time. Yvonne Coghill, thank you very much for joining us.
No problem.